Endometriosis is a common health problem for women. It is a condition where tissue similar to the lining inside the uterus, called the endometrium, starts to grow outside the uterus. This can lead to a variety of symptoms and complications, making it a significant health issue that requires attention and understanding. It affects millions of women around the world. In fact, it's estimated that about 1 in 10 women of reproductive age are affected by endometriosis. This means that no matter where you are, there are likely many women around you who are dealing with this condition, often silently. Endometriosis is a serious condition. It can cause chronic pain, which can be severe and debilitating. This pain is often associated with menstrual periods, but it can also occur at other times. The pain can be so intense that it interferes with daily activities and quality of life. It can cause significant pain and other debilitating symptoms. These symptoms can include heavy menstrual bleeding, pain during intercourse, and infertility. The impact of endometriosis goes beyond physical pain, affecting emotional and mental well-being as well. It's important to understand this condition. By learning more about endometriosis, we can better support those who are affected by it. Education and awareness are key to improving the lives of women with endometriosis. We need to raise awareness and support those affected by it. Endometriosis is often misunderstood. Many people, including some healthcare providers, may not fully understand the condition, leading to delays in diagnosis and treatment. It's not just about painful periods. Endometriosis can affect many aspects of a woman's life, including her ability to work, her relationships, and her overall quality of life. The pain and other symptoms can be unpredictable and vary from day to day. It's a complex disorder that can impact many aspects of a woman's life. Women with endometriosis often have to navigate a range of challenges, from managing pain to dealing with the emotional toll of the condition. It's important to recognize and validate their experiences. We will explore the symptoms, causes, and treatment options available. Understanding these aspects can help women make informed decisions about their health and seek appropriate care. We'll discuss its symptoms, causes, and treatment options. By gaining a deeper understanding of endometriosis, we can work towards better management and support for those affected by it. This information is crucial for women of all ages. Whether you are experiencing symptoms yourself or supporting someone who is, knowledge is empowering. It can help you navigate the healthcare system and advocate for the care you need. It can help you understand your body better. Recognizing the signs and symptoms of endometriosis can lead to earlier diagnosis and treatment, which can improve outcomes and quality of life. It can also encourage you to seek help if you experience symptoms. Many women suffer in silence, not realizing that their pain is not normal and that help is available. Reaching out to a healthcare provider can be the first step towards finding relief. Remember, you are not alone. There is a community of women who understand what you are going through and can offer support and encouragement. Connecting with others who have similar experiences can be incredibly validating and empowering. With knowledge and support, you can navigate the challenges of endometriosis and live a fulfilling life. By raising awareness and advocating for better care, we can make a difference for all women affected by this condition. Endometriosis occurs when tissue similar to the lining of the uterus grows outside of it. This condition affects millions of women worldwide and can have a significant impact on their quality of life. The tissue that grows outside the uterus behaves just like the tissue that normally lines the inside of the uterus, but it is located in places where it shouldn't be. This tissue is called endometrial tissue. It is designed to thicken, break down, and bleed during the menstrual cycle, preparing the uterus for a potential pregnancy. It normally lines the inside of your uterus, creating a suitable environment for a fertilized egg to implant and grow. However, in endometriosis, this tissue is found outside the uterus. In endometriosis, this tissue grows in other areas, such as the ovaries, fallopian tubes, and the lining of the pelvis. These areas are not equipped to handle the changes that the endometrial tissue undergoes during the menstrual cycle. When the endometrial tissue grows in these locations, it can cause a variety of symptoms and complications. This misplaced tissue continues to act like it normally does inside the uterus. It thickens, breaks down, and bleeds with each menstrual cycle, just as it would if it were inside the uterus. However, because it is outside the uterus, the blood has nowhere to go. This can lead to the formation of cysts, scar tissue, and adhesions, which are bands of fibrous tissue that can cause organs to stick together. This can cause inflammation, pain, and other problems. The pain associated with endometriosis can be severe and debilitating, affecting a woman's ability to carry out daily activities. In addition to pain, Endometriosis can also cause fertility problems, making it difficult for some women to conceive. The symptoms of endometriosis can vary greatly from woman to woman. Some women experience no symptoms at all. Others have mild discomfort. Some women have severe pain that disrupts their daily lives. The most common symptom is pelvic pain. This pain can be chronic or occur during certain times, like during your period. Other symptoms include painful periods, pain during sex, and irregular bleeding. You might also experience digestive issues like bloating, constipation, or diarrhea. Endometriosis can have a profound impact on a woman's daily life. The pain and discomfort can make it difficult to work, exercise, or socialize. It can affect relationships and intimacy. Many women with endometriosis experience fatigue and low energy levels. The emotional toll of living with chronic pain can also be significant. It can lead to anxiety, depression, and feelings of isolation. Seeking a diagnosis. If you are experiencing any symptoms of endometriosis, it is important to see your doctor. Getting a diagnosis can be a long process. It often involves a physical exam, a pelvic exam, and imaging tests like an ultrasound. A laparoscopy, a minor surgical procedure, may be necessary to confirm the diagnosis. Don't be afraid to advocate for yourself and ask for a referral to a specialist if needed. Early diagnosis and treatment are crucial for managing symptoms and preventing complications. Available treatment options. There is currently no cure for endometriosis, but there are many treatment options available to manage symptoms and improve quality of life. These options can range from lifestyle changes to medical treatments and even surgical interventions. Each approach aims to address the unique symptoms and challenges faced by individuals with endometriosis. Treatment plans are tailored to each woman's individual needs and may involve a combination of approaches. This personalized approach ensures that the treatment is as effective as possible, taking into account the severity of symptoms, the patient's overall health, and their personal preferences. Pain relief medication, such as over-the-counter pain relievers or prescription medications, can help manage pain and discomfort. These medications can be particularly useful for managing the chronic pain that often accompanies endometriosis. However, it's important to use these medications under the guidance of a healthcare provider to avoid potential side effects and ensure they are effective. Hormone therapy, such as birth control pills or hormonal injections, can help regulate hormones and reduce endometrial tissue growth. This type of treatment can be particularly effective in managing symptoms and slowing the progression of the disease. Hormone therapy works by reducing or eliminating menstruation, which can help prevent the growth of endometrial tissue outside the uterus. Surgery is another option, ranging from minimally invasive laparoscopic procedures to remove endometrial tissue to more extensive surgeries like hysterectomy. Laparoscopic surgery is often preferred because it involves smaller incisions, less pain, and a quicker recovery time. In more severe cases, a hysterectomy, which involves the removal of the uterus, may be considered. This is usually a last resort and is typically recommended only when other treatments have not been successful. In addition to medical and surgical treatments, lifestyle changes and complementary therapies can also play a significant role in managing endometriosis. Practices such as yoga, mindfulness, and physical therapy can help reduce stress and improve overall well-being. Support groups and counseling can provide emotional support and help individuals cope with the challenges of living with endometriosis. A holistic approach that includes both medical treatments and lifestyle changes can often provide the best results for managing this complex condition. New research and promising treatments. The medical community is constantly working to improve treatments for endometriosis. New research is providing hope for more effective and targeted therapies. Promising areas of research include new medications that target specific pathways involved in endometriosis, non-hormonal therapies that offer fewer side effects, and a deeper understanding of the role of inflammation in the development and progression of the disease. Living with endometriosis. Support and resources. Living with endometriosis can be challenging, but you don't have to go through it alone. There are many resources available to provide support, information, and a sense of community. Support groups, both online and in person, can connect you with other women who understand what you're going through. Organizations like the Endometriosis Foundation of America and the World Endometriosis Society offer valuable information, resources, and advocacy efforts. A hopeful future for endometriosis. While endometriosis can be a difficult condition to live with, there is hope for the future. With increased awareness, ongoing research, and improved treatment options, women with endometriosis can look forward to a brighter future. By working together with doctors, researchers, patients, and advocates, we can continue to advance our understanding of endometriosis and find better ways to manage and treat this complex condition. Remember, you are not alone and there is always hope. Thanks for watching and see you next time.